afternoon, a happy April. We're having some technical issues here, so I apologize for that. How is everyone doing these first few days of April? You know what they say, April showers bring May flowers, so I'm really counting on that. So anyway, welcome. And we always have to thank our crew. And once again, Courtney Hayes is doing the heavy lifting by doing all the technical work behind the scenes tonight. So Courtney, thank you, thank you. Also, thank you to Audrey Belfaro with our ADRC and Tom Roth with our CTSI. This is the team that helped make everything possible. So thank you to everyone. I hope you've been enjoying our crazy spring weather, but at least around Winston-Salem, it's supposed to be pretty for this weekend. So I'm hanging out for that and hoping that this rain is going to bring just glorious blossoms in my garden. So let's get this program started because we have a full agenda for you tonight. There's that television show long ago, Cheers, where you go in and everybody knows your name. Well, this is about as close to that as a restaurant in Winston-Salem. West End Cafe is a longtime restaurant in kind of halfway between West End and downtown Winston-Salem. And the chef there is Justin Vernon, and he shared a recipe with us to make this wonderful arugula salad, spring salad. But then when you add your protein of choice, so maybe chicken or fish or scallops, it really does become a beautiful spring dish. So without further ado, I'm going to turn it over to Chef Vernon.
Hi, thanks Deb. We're very happy to be a part of AgingWell. Today we're going to talk about our arugula salad that is on our new spring menu here at West End Cafe. My name is Justin. I'm the chef here. We start off with some nice organic carrots. We peel them and then boil them for anywhere from 10 to 15 minutes until they're nice and tender. At that point, we take them and blend them up. So we're making a nice, bright carrot puree. It's got a little bit of honey in it. It's been salted, peppered, and that's really it. It's very plain, simple, but tasty and bright. Then we've got some nice, organic, heirloom baby carrots. We're going to toss those in a little bit of olive oil, salt, and pepper, and then we're going to roast them for about 20-25 minutes until once again they're nice and tender, full of flavor, and very pretty to look at. From there, we found some walnuts, and we've roasted the walnuts off. Just a little bit of salt, really just bringing out the nutty, deep flavor of walnuts. And then we've taken some goat cheese, pattied up, and then covered in those walnuts to make little goat cheese walnut cakes. But we're not done with the walnuts. We take also some of those roasted walnuts and mix them with basil, parsley, arugula, olive oil, garlic, and Parmesan, and make a nice pesto. The pesto, at that point, we will mix with some oil, some red wine vinegar, and then toss our arugula greens in it. So a little bit of olive oil, a little bit of red wine vinegar, and just a pinch of salt. I'm going to grab a glove and just toss this all together. Add a nice little spoonful of arugula, and then toss all that together. So we're really coating the arugula in oil. That vinegar gives it a bright little acidic kick, and the pesto really sticks to the leaves and makes sure that you've got a lot of flavor in every bite. Now the secret to this salad's wonderful taste might also be the thing that keeps it from being as healthy as we would like, and that is the candied bacon. And I basically took a sheet pan, laid out strips of bacon, par cooked it, so I only cooked it halfway, and then sprinkled brown sugar over the bacon. So yeah, brown sugar on the bacon. And that's my favorite part. I guess we can try to put one of these together now. So, nice big plate. And I'll take this bright carrot puree and a dollop on the plate, and then just smear that with the back of a spoon. Then we take some of our pesto with the roasted walnuts in it, and we're just gonna, right in the middle, nice little pile of it. And then our greens, which have been tossed in the pesto and a little oil and vinegar, we're gonna drop right there in the middle of the carrot, so that as you're eating it, you scoop up a little bit of that carrot puree with every bite of salad. Some of our roasted heirloom baby carrots. Give it some color. Then we've got our goat cheese and walnut cakes. We'll put one right there and one there. And now our candied bacon that we will just place a little bit everywhere. And this is our spring arugula salad. So now we're going to talk about ways to make this more of a complete meal by adding a protein. So right now, two options, and we're not limited to these: a piece of steak, a piece of chicken. There's all kinds of things that could go onto this salad that would really complete it well. But I have chosen some scallops and a piece of salmon. And my first step with any seafood would be to pat it dry. Moisture is just going to keep you from getting a good sear on it, and a good sear is really what sets a piece of fish apart from, something not as good. So, pat it dry, and then a little salt and a little pepper. And we'll do that to both the salmon and the scallops. And then, your secret to a good sear, aside from the patting dry that we've discussed, is to get your pan very hot. Very hot. Like starting to smoke and you think it's too hot, you're ready. So we've seared off our scallops and salmon. And you want to do a good sear because what you're doing is you're caramelizing the sugars. So you get that scallop pan really hot, and you leave them in until you turn and they're getting brown, like dark brown, and that's when you know you've got a good sear. Flip your scallops and then turn off the pan. You can let them sit in there for a minute. They will keep cooking, but you don't want an overcooked scallop. Unless you do, and then overcook it. But I suggest you stop the cooking after that sear. Salmon, I feel the same way about. A nice hard sear to caramelize those sugars and get that crust formed. Flip it over and kill it. Just take the heat off the pan. You can let it sit in there. It will continue to cook, but you don't want to overdo it, or you've got tough salmon, and no one wants that. I'm going to get a glove and just show how I would add the scallops. I would nestle one right in there where the pesto is. Get one sitting right over here where the carrot puree meets the goat cheese. And maybe one right up here beside some of that candied bacon, because a bite of a scallop with some candied bacon It's going to make your day a little better. As far as the salmon went, I would probably just lay it right across the top. And then once again, every bite of salmon you take is going to have a little bit of those other components to just, I'm going to say it, to have a little party in your mouth. It's perfect. We do have some of the West End Cafe dinner bread that we dunk in butter and then put cheese and herbs on. Maybe not the healthiest thing, but it's good eating. If you wanted to have some bread to accompany this, we also could do some grilled pita, which would make it very easy to get every last bit of that carrot puree, pesto, all the mixed up flavors that are left on that plate at the end. All right, so this would be our finished product. This is our spring arugula salad, carrot puree, roasted baby carrots, candied bacon, walnut goat cheese cakes with a walnut pesto. Thank you, AgingWell, for letting us share this with you. And we are here at West End Cafe Monday through Saturday, 11 most days, 12 on Saturday. And we've just released our new dinner and entree menu. Please come see us. Thanks again, Deb. Thank you, AgingWell.
Well, take it from me, that salad really is wonderful, and it's just so healthy and fresh. Anyway, so now that we've had a wonderful meal, it's time to do something fun. And you know, Winston-Salem is lucky in that we have so many different organizations that provide opportunities for us all to have fun, stay active, do meaningful volunteer work, just anything you want to do, you can find it here. One organization that's especially close to my heart is the Shepherd Center of Greater Winston-Salem. I serve on their board, and as such, I get to hear about all these cool programs that they're doing throughout the community. And so that's how I learned about this one in particular that we're bringing to you tonight. So Kristen Larson is over there. She is over the now I'm just blanking on it, the Healthy Lifestyles program. And she was telling me about Karen McLaughlin, who makes wet felting. And all of us on the board were just going, what in the world is wet felting? And so Karen joined us at a recent board meeting to share this with us and invited me to come out and be a part of it for AgingWell. And so thank you to Monica Winter, because she was the wonderful student that really just kind of let me follow her through the process. So without further ado, so you will learn what wet felting is and how maybe you can get involved in a future class. So I'm going to turn it over to Kristen.
Thank you, Deb. It's great being back at AgingWell. We have a lot of new, exciting, fun new programs here at the Shepherd Center. One being wet felting. If you would like to attend, please reach out to me, or if volunteering is your thing, these classes will be right up your alley. Let's take a closer look at the wet felting class. Here's Karen for more.
Okay. Thanks, Kristen, and welcome to AgingWell. We are going to be showing you what wet felting is all about. We offer classes through the Shepherd Center in both from beginners levels, where you learn all techniques that you can expand to advanced levels, which is working with silk called Nuno silk. Now, I'm going to show you a piece with Maria. She is a beginner. We start off by teaching you how to make fabric, which is what wet felting is all about, is making fabric. And this is her first piece. Isn't it beautiful? And thank you, Maria. Now we will move on to the next. We're going to show you the basic steps that start in this process. First thing we start with is a beautiful piece of silk. Introduce yourself.
Hi, I'm Monica, and I'm a new advanced student, and we're going to start putting some decorations and some felt on.
The tools that I have my students use are bubble wrap, a million fingers to help them work it, a pool noodle, which we use to wrap the wet silk and wool around. Now, we're at the stage right now where we're doing a layout, just set that over there. And what we do is we roll out the pool noodle with the bubbles up, making sure that the bubbly side is up. The fabric goes on top. Pull it down that way a little more, okay? And I have the students pick sparklies and extra pieces to make it fancier. Yep, just roll it out. When it's laid out, before it's wet, there's all sorts of little strings and what we call roving, which is wool before the spinners spin it. And that's wool. And then it's all laid out. Now we're going to lay out Monica's piece. We just wanted you to see what it looked like when it was first wet and why all these strings are there. Right. At this point, she's chose her sparklies. Now she has to choose her base wools. Go ahead. Oh yeah, okay. I have the students pick a group of them, and then it gives them a chance to play with their design before they wet it or before they start tearing it apart. At this point, the synthetics have to be laid first because the wool holds them on. The synthetics will not. Wet felting causes the natural fibers to open up, that the barbs that are in them, so that they connect and pull together into a new fabric. And that's what we're doing. We're making a new fabric. All right. We try to get an accent color in, and I try to get my students to expand themselves so that they don't just one color. Wait on those. Yeah, wait on those. Pick your 3 base colors that are going to be more first. We also have to work on structure because you need to have this hold together. The silk will hold it together, but the wool helps. Okay. We have a lot of different colors. When we work with the roving, we try to make sure that it is all going the same direction because they get twisted up. And then what we do is we start dividing it, because in this process, instead of trying to make a very thick piece of wool, we're trying to make it as feathery and light as possible. Now, I'm only going to do a suggestion for Herb, and she's going to have to lay the rest of it out. When you have the raw edge, I cut these long enough so that you had a little area for a ruffle, okay? I suggest opening it up and making it kind of like a creative edge. Do you see what I'm doing? And leave a little bit on the ends. And I structure mine this way. It's not necessary. They can do it any way they want, but it's the idea is to be more free about it. And so you can do stuff like this. You can curl it. You can snake it. This is when you can have total freedom and fun. You're not working a structure that has to be rigid. And it is not so much time consuming. It does take time, but the result is well worth it. It is also very creative because she is going to be putting lots of different colors and different parts on it. The way when we roll it is that it is literally a cardio exercise that I used to do, and it creates this lovely relaxation in your shoulders, and you get some exercise doing this. So it's a combination of, it's a creative thing, but you're exercising your body. You're using your arms and your back and your heart. At this stage, Monica is going to place her sparkly. This is a synthetic, so it has to be layered into the wool for it to attach. Okay, go ahead. Relax, flow, have fun with it. It's a river of color. Excellent. Now we're going to add a yarn that's 100% wool. This will also help with the attachment to the piece, and I'm going to give you a lot of extra, okay? And you can swirl it, you can stripe it. And as you see, she's draping it through. The roving will catch into the silk. It'll also catch these strings. We do these strings to add some dimension and a little sparkle to the pieces. They can be plain, but this is where it just is basically what it is. Now, but then this is where it becomes a social thing. We help each other. We work on it together. You know, I'm not here to create it, they are. But in any creative environment, it's always good to share your ideas and to expand your ideas. This is another type of wool. We use merino wool, but this was, I believe it was said Corriedale. It is a little tougher in the sense of attaching because it's felt a little differently. Okay. You're just going to plop those all the way up and down. Just pick them, loosen it up, then just plop it down. This is a very loose art. It's like painting with wool. And she's going to use little pieces of this color through as an accent. I don't think you need any more of that, but you know where to find it. Now at this point, she's accentuating. She's making sure that the polyester sparkly thread is, and it just is a light, airy. See how light and airy she's using it now. In the beginning, we learned how to make a thick, solid piece of felt, but in this process, it's getting this very thin, delicate, woven nature of it. We lay the tulle on top of all of this because we need to wet it and to manipulate it. This is tulle. No, you need to hold that end. Once you lay this down, don't put it down yet. Can you, Maria, pull that bag out of there? Thank you. Take it all the way to the end. This holds the wool in place for the process. We use olive oil soap done into a wet solution. We now have to wet this and attach the wool enough so that she can roll it up and start the actual felting process. So what we do is we run this right up the center like this. The most in the center because the pressure pushes it out to the sides. You need to finish that up, and it's a direct stream, go all the way down to the end. Okay, we're both going to do this. We take our hands and we move the water around, and what it's doing, it is like gluing the wool down onto the silk so that eventually we will start rolling it. In the past, we would have been doing this for hours to get it to attach. But due to technological advances, bubble wrap becomes a million fingers in place. The idea is to get the wool in place so when you take the tulle off and roll it, it doesn't collapse or shift all over the place. After putting the tulle on and working it, we now have got some attachment to the silk. So we can remove the tulle and just fold that up. And this is the beginning stages of the true felting. At this point, we're going to take the pool noodle, and that's your ruffle down there. We wrap the whole piece up, we roll it up, put some more water on it. Run a little more. Here, let me just get this part here. We put a little more water at this point and soap. This is olive oil soap that we're using in a liquefied, looser, like 3 to 1, 3 water, 1 soap. And then we roll it up into the pool noodle, perfect. And then it's the tedious but fun rolling that creates and forces the wool fibers through the silk. Your ties. Okay. Ooh, that's a long one.
Yeah, the ones I got were too short.
No, tighter. It's got to be tighter than that. Thank you. You do it really tight because you're going to be exerting pressure and rolling it. We roll it 10 times, and that's back and forth 10 times. Then we reverse it, so what was on the inside of the roll will be on the outside. That is done another 5 to 10 times until it all attaches. This is the position we get into. Okay, Monica? Mm-hmm. This is, you're going to use your body weight and pressure. You're also not grabbing it. You're using these areas here, and you start in the middle and you roll it up almost to your elbows. And you're rocking and you're giving yourself a little, like you're doing a small, light cardio. Not too much. We don't want back strain, you don't want neck strain, but you're pressurizing all those bubbles in there, okay?
Well, I thought you might like to see the finished product after I completed all the additions that I put on the scarf. I didn't realize when I started this class that you could felt into silk, and so that was one of the things that surprised me. So all of these little silk attachments that I put on, with the pressure and the heat and the water, it makes it become part of the fabric. And I can use it as a wrap if I wanted to. Or some of the other ladies, one of them was going to take hers and mount it and use it as a wall hanging. So I think it's fun that we can do a lot of different things. And yeah, I think that this is a really good class that the Shepherd Center offers, and it's fun to be with the other ladies and do something together and learn a new skill, and I'm really looking forward to the next one.
Well, thank you, Monica, for inviting me over so we could see the finished product. But wasn't it just absolutely gorgeous? And if you had put a gun to my head, I would not have been able to tell you what wet felting was until I got to attend this class. So thank you, Karen, for letting me join, and thank you, Monica, for letting your piece be the subject of this video. So it was so much fun. And just so y'all know, with this, we always send out the link to the videos following when it's happens live. So it'll probably be Thursday or Friday of this week. I've got lots of different information from the Shepherd Center of many, many different programs that they offer. So I think no matter what you're looking for, I think you may find just something that may pique your interest. So anyway, now let's get down to the education of tonight. We have always been told you want a beautiful white smile, brush your teeth, how many times a day? I was always taught 3 times a day. And, there's a lot more to it than just having a beautiful smile. And so tonight we're lucky that we have Mashica Jefferson Tobias. She is a state public health hygienist with the Forsyth County Department of Health. And so she is going to join us tonight to really give us the once over about why, more than just brushing our teeth to have a beautiful smile, why our oral health is so very important to the health of our whole body. So anyway, Mashica, I'm turning it over to you.
Hello, how's everyone doing this evening? Thank you for having me come and speak to you all with the Aging Well series. I'm happy to be here. I'm going to talk to you today about how your overall health affects your systemic health. We always think about how healthy our teeth are, but we don't always take into consideration that we need to tie the two together. So what I mean by that is that you have to have a healthy mouth, healthy teeth, so that you can have a healthy body. So I'm going to start my slides for you all. So there are several potential dental problems for us, for older adults. So there's periodontal disease, also known as gum disease. My grandparents used to call it pyorrhea. Cavities are a potential problem, especially when they are on the roots of the teeth.
Mashica, we're not seeing your slides yet.
Okay. Okay, how about now?
Not yet.
Mm,
Did you hit the share screen?
I did. Let me go back. Can you see them now?
Yes. And if you go to slideshow and go to beginning, go all the way to the left from beginning. Yes. Yes, right there. Yes, perfect.
All right. Sorry about that, guys. So as I was saying, there are lots of potential dental problems that come as we get older, but gum disease can also affect us when we're younger too. So we have to consider gum disease, and gum disease starts to happen when the bacteria gets below the gum and stays there long enough to start eroding away the bone support around the teeth. And then as time goes on, if that's not corrected and the bacteria stays there long enough, you end up with bone loss around the teeth, and the teeth can start to get loose. When we think about cavities on the root surface is so very important because the root surface does not have the enamel covering like our teeth do. So when we smile, we see enamel. The enamel is what's covering the teeth. But when we get into root exposure, which can come from either brushing too hard, which would be mechanical, it could come from grinding your teeth, and that grinding of the teeth breaks the little fibers that hold the gum up next to the tooth, and then the gum attachment rolls down and the root is exposed. And so those roots don't have the enamel covering like our teeth do. And they are very susceptible to getting cavities. And once you start getting cavities on the root surface, they can become very hard to treat, and sometimes they can run rampant. And so when you're thinking about brushing, you want to make sure that you're not scrubbing back and forth too hard, so that you're not wearing away the fibers that hold the gum next to the teeth. And you also want to take into consideration, if you grind your teeth at night, to maybe get something like a night guard so that you can help protect your teeth and your jaw. When we also think about dental problems, tooth loss is also a problem, losing our teeth. Now, when you come into the dental office and you have a cavity, or even if you have a toothache, our goal is always to save the tooth. Sometimes, if it's too advanced, we can't save the tooth, but our overall hope is that we can save the tooth. I know that sometimes cost is a factor when it comes to having to have a root canal and crowned and things of that nature, because if you get a root canal, then you definitely need to get a crown, especially if it's on the back teeth, so that those teeth are protected. Once you get a root canal and the blood supply is gone from that tooth, that means there are no more nutrients going to that tooth. That tooth can become brittle. And so that's why you need to get a crown. But I know that that can also be overwhelming when you are presenting someone with the cost of a root canal and the cost of a crown. That's a factor. Oral cancer is also a consideration as a dental problem. Tobacco use and dry mouth and candida infections. And I'm going to get a little bit more into oral cancer in the next few slides. So when we think about dry mouth, another name for that is the xerostomia. And so that can happen as a result of getting older, but can also happen when you have treatment, chemotherapy treatment, radiation treatment. Some medications can cause dry mouth. And so you have to know the side effects of your medications. The dry mouth puts you more at risk for cavities and gum disease because there is not the natural flow of saliva to help naturally rinse the teeth. And when we think about the natural flow of saliva, I always tell people a good way to know that you need to drink more water is to check your saliva. And so when you get ready to spit and it's very ropey, thick, doesn't break off easily, that's a good indication that you need to drink more water. The thinner your saliva, the better natural rinsing you have on your teeth to help try and protect from cavities and dry mouth. And the dry mouth can also have people have trouble with swallowing and talking. If your mouth is feeling very sticky and dry, and your tongue is not moving around like it needs to, then that could be an issue. Water will help. And with dry mouth, you can also start to have a burning sometimes with that, a burning sensation because the tissue is dry and may peel some. So April is National Oral Cancer Month, Oral Cancer Awareness Month. You can do your own self checks of your mouth, own regular self checks of your tongue and around your lips. So when you're looking at or thinking about how to do your own self checks, I always tell folks to get in front of a mirror. If you get in front of a mirror, you can stick your tongue out You can look at the sides of your tongue. You can lift the tongue up to the roof of your mouth. You can check in the floor of your mouth. You can use your fingertips and feel around the borders of your lips and see whether or not you feel any lumps or bumps or anything, so that you are always staying on top of things in between your dental visits. Now, if you're on a 6-month recall and you're getting your regular 6-month checkups, then that's good, but you also want to check in between. Sometimes if you are in what we call periodontal maintenance, you may be on a more frequent recall, and that's fine too if you're going every 3 to 4 months. But still, since it's your health is very important. Be sure and do your own self-check exams in the mirror. The oral cavity and oral pharyngeal cancers affect over 700,000 individuals each year worldwide. So early cancer detection is critical to improve the survival rates. And in some areas, there may be free screenings in the month of April, depending on where you live. Because it's Oral Cancer Awareness Month, sometimes different locations offer free oral screenings. And this is the same, making sure that you're doing your own self-checks. Now, when it comes to dry mouth and treating dry mouth, a solution for that is using some of the saliva substitute products. One out on the market would be the biotin. The biotin adds moisture to your mouth. If you use the gel can add up to 4 hours of moisture retention at a time. For store brand, I always tell people the biotin is going to be more expensive. You can also use the CVS brand, Walgreens, Walmart, because something is going to help you better than others, better than nothing. So these products also come in gum and toothpaste, but I just always find that the gel is the one that adds the most moisture retention. Now, when it comes to dry mouth also, you can get candida infections. Those are a consideration. And so when it comes to a candida infection, that's like a yeast infection in your mouth, you can use the nystatin rinse or the lozenges to help with that. And here are some other just products to use. For dry mouth, there's also the Xylamelts, little tablets that you can put in, and they're dissolvable, and then the biotin. For the Sensodyne is good for dental sensitivity. So according to the CDC, nearly all adults, 98% aged 65 and older, have had a cavity. 1 in 5 adults have untreated tooth decay. Nearly 1 in 5 adults aged 65 and older have lost all of their teeth. Complete tooth loss is 2 times as common for adults aged 75 and older compared to people aged 65 to 74, which is 26%. Adults aged 65 to 74 have missing teeth or they're wearing dentures, which can affect their nutrition. And this is 13% of the population. So when it comes to nutrition and still maintaining your good oral health, you need to have teeth to chew and be able to help with the digestion of your food. So that's also something to take into consideration. With tooth replacement options, there are crowns and bridges, dentures, partials, and implants. To clean the bridges and implants, you can use what we call super floss, the little interdental brushes that are like little picks on a stick, but they have the bristles. You can also use floss threaders. You can try water pick, what we call either a water pick or water flossers. They kind of look the same. But water flossing has become very popular, and water flossing is also very effective. If you have dexterity problems and you have trouble holding and manipulating the floss, you can use a water flosser. You can also use the little dental picks that are on a wishbone. You can use those. You can also use a floss holder, but with the floss holder, you have to thread it yourself. And so it may be better, depending on your preference and your hand dexterity, to use something like the water pick, and other brands are going to be a water flosser. When it comes to cleaning your partials and dentures, of course, you want to make sure that you're brushing those. But you can also use what we call an ultrasonic cleaner, and it would remind you of a jewelry cleaner, kind of along the same things. But those ultrasonic cleaners, you can get them, you can order them online, and you can use them for dentures, partials. If you have younger children, you can use them for retainers as well. And these are some examples of some tooth replacement options. So you have here, if you can see, the implant is an option. You've got the crown, like we were talking about, after you've had a root canal, the partial. This would be a prep for a bridge, a 3-unit bridge. So there's the prep, and then there's the bridge. And then you can also get an implant bridge. And so there are lots of options out there to replace the teeth. You're just going to have to pick the one that you prefer and the one that works best for your budget. So when we think about health concerns and dental risks, things that are a factor would be acid reflux, because the acid coming up, coating the back of the front teeth, is a factor. That's a popular place for when you have acid reflux, is around those front teeth, for you to have some dental issues. Chemotherapy treatment, heart disease, diabetes. With diabetes slows down the healing time. For example, if you've had an extraction or some other kind of oral surgery, gum surgery, those things, if you're diabetic, your healing time is going to be different than the person that is non-diabetic. And then we've already talked about the dry mouth caused by some medications. Some other health concerns that could slow down your healing and affect your dental health would be immunodeficiencies, inflammatory disease, inflammation that's already in the body, nicotine, tobacco use, and the tobacco exposure on the tissue. So with tobacco, we want you to not use tobacco products, the nicotine, because of the damage that it does to the tissue. The heat, even though it's not a lot, it's still something that can affect the tissue. And tobacco, what I tell people is that tobacco is not tobacco like it was many years ago, when it came straight out of the tobacco field, and it was relatively more pure. Today, tobacco has all kinds of other ingredients and things in it, bits of metal and other kinds of chemicals in it, and those cause a lot of harm. Those can cause the oral cancer, and you don't want to get into where you have the oral cancer because of the tobacco use. The tobacco use, the easy prevention is to just not use the tobacco, which I know can be easier said than done. For health concerns and dental risks, your genetics are going to be a factor, meaning inherited health issues. And these are just some things to name a few. Here are some other systemic diseases that go along with gum disease. When you have the high blood pressure, diabetes, the glaucoma, your vitamin intake is an important factor. And some other examples about how your oral health affects your systemic health. The mouth affects the heart. Your bone health would be your jawbone with the osteoporosis and vitamin deficiencies causing the osteoporosis. And I just want to say that when you have osteoporosis, the first place that your body taps into to try and replenish the bone source is going to be your jawbone. So nutrition is very important to help combat the osteoporosis. Your heart and lungs are also affected with poor dental health. So this is something that Deb, when she first asked me to do this class, something that really got her attention, something that she was very concerned about was dental abscesses and the problems with infective bacterial endocarditis. So when you have dental abscesses, if you notice an abscess, please go to your dentist. If you don't have a dentist, worst case scenario, go to the emergency room. Please don't let it sit, so that you can get an x-ray and some antibiotics if needed. If this will help protect you so that you don't get any of that bacteria into your bloodstream and it affect your heart, the valves, or the heart lining. So with dental abscesses, if they're sitting there long enough, and especially if they're on the upper teeth on the top, they can affect the sinus. They can affect your brain. The infection will spread if it isn't treated. And bleeding gums is a concern, and like I said, can result in the bacterial endocarditis. It doesn't happen often. It is rare, but it can happen. And so this happens when the harmful bacteria under your gums get into your bloodstream, and it travels and settles around the heart valve, the lining of your heart, or a blood vessel, and sets up infection. And you can get very sick from this. You can end up on IV antibiotics as a result of bacterial infective endocarditis. It's a common, some of the risk factors are folks that have had previous heart valve disease, IV drug users, heart valve surgery in the past, congenital heart disease, a history of bacterial endocarditis in the past. So in some instances, if you have heart issues, your dentist may want you to take pre-medication, and that would be antibiotics 1 hour prior to dental treatment, and then 6 hours after your treatment. And this will help to reduce the amount of bacteria in your bloodstream to help keep you from getting sick. And it doesn't just come from dental treatment, it can come from brushing and flossing your teeth and making your gums bleed, because that bacteria that's under there is harmful and it still gets into the bloodstream. Rare, but it can happen. When it comes to dental products, and I have folks asking me, what's the best toothpaste? So I always say the best toothpaste is going to be something with fluoride. I don't recommend any particular brand over the other. I use all of the brands. The main thing is that you like it and it has fluoride. Now, there are some folks that don't like fluoride and they prefer to use something like the Tom's toothpaste, and that's fine too. So the main thing with the toothpaste is using something, you're looking for something with the American Dental Association seal on it, seal of approval, the ADA seal. When you think about sensitivity toothpaste are good when you have dental sensitivity. Sensodyne is a good product. You can also use a store brand, CVS, Walgreens, Walmart brand toothpaste. The Sensodyne is the best one out on the market. The ingredients in there help to fill in the little open pores, little open tubules in the root surface, so that you get relief from the dental sensitivity. And so what happens is when you have teeth that are sensitive and there's root exposure, and we've already talked about recession, there's root exposure. Those roots have a lot of little open pores in them. And the way the toothpaste work is the ingredients fill in the little open pores in the toothpaste and act kind of like a thermal insulation. And they provide a protection over the root surface so that the sensitivity is relieved. And so what I recommend to folks is that when you're using the sensitivity toothpaste, use, no more than 2 tubes at a time. Go to back to a regular toothpaste. The reason that I say that is so that the next time you have sensitivity and the ingredients in there have washed out of the roots of those teeth, out of the pores of those teeth, and the teeth are sensitive again, you go back to the Sensodyne and it works. And so if you're using it all the time, you may become immune to the benefits of the sensitivity toothpaste. And so that's why I say use 2 tubes or so in a row and then go back to a regular toothpaste so that you have some relief from the sensitivity.
Mashica, I just want to let you
Yes.
know we're almost at time.
Okay.
So we
Okay.
can certainly go over if there's any questions, but I just wanted to let you know.
Okay. All right. Thank you. All right. And some toothpaste may be too chemically strong for you. There are a lot of toothpaste out that do a lot, and so you want to keep that in mind. If you're noticing sloughing of the tissue, then you want to go to a different toothpaste. Tongue scraping is a good thing to use. The reason is that your tongue collects plaque and bacteria and food debris just like your teeth do. And so you want to make sure that you're cleaning your tongue, and that will help to make sure that you're enjoying the full flavor of your foods. Soft toothbrush, like I said, the electric toothbrush is good, especially if you have some dexterity problems. And those toothbrushes have the built-in quad pacer so that you don't have to worry about timing. You should be brushing 2 times a day for 2 minutes. Should be replacing your toothbrush every 3 months and sooner if you've been sick. Type of floss is up to you. I use waxed, and that's what works better. When it comes to your dentures and partials, please don't sleep in your dentures and partials. You want to make sure that the tissue has time to breathe. And so taking your dentures out at night, you can soak them to clean them, but make sure that you do not sleep in dentures and partials so that you don't end up with red places and sore places in your mouth. And this is just a little infographic on the night routine for your dentures. Caregivers. I know a lot of us sometimes are caregivers. I'm a caregiver myself for my son. I have parents that have gotten older. You want to maybe use a face shield when you're trying to brush your loved one's teeth to help protect your eyes. So that's something that can to keep in consideration, as well as an electric toothbrush. And so for the final takeaways, make sure that you're brushing 2 times a day, 2 minutes, that you're flossing every day using either a water flosser, the little interdental brushes, or regular floss. Maintain a healthy diet, limit sugar, because your nutrition affects your teeth. Make sure you're drinking water to help keep your saliva thin, and make sure to remember to do your own self-exams so that you can be aware of whether or not you have any changes of the tissue. And if so, be sure and get a dentist. If you notice something, don't let it stay there for more than a week. Call your dentist, make an appointment so that you can get it checked out. So I want to thank you all for having me. And I hope that you got some good information out of this that you can use.
Well, I can tell you, we already have some questions coming in. So if you want to stop sharing your screen, I will help navigate the questions and give them to you, and you can let folks know what the answers are going to be.
Okay.
All right, so let's start. Are mouthwashes satisfactory to use often?
They are. A mouthwash with fluoride will help protect the teeth. Even if we're older, we don't have to be children to get the benefits of fluoride. So you can still use a fluoride rinse and be able to get benefit. With the mouth rinses, we want to keep in mind that they freshen the breath, and that you can also choose a 0 alcohol mouth rinse. You don't have to use if it's very sensitive and it burns. The 0 alcohol rinses do just as an effective job as the Listerine with alcohol. So Listerine with or without, or whatever kind of other rinse that you choose. Not saying
Okay.
one brand over the other.
Okay. Can older people brush too frequently?
So you should brush a minimum of 2 to 3 times a day, 2 times a day for 2 minutes. I don't think that there's any such thing as too frequent. Main thing I want you to remember is soft toothbrush, and that you're not scrubbing back and forth when you're brushing. And if you have places where you have root exposure, still make sure that you're not scrubbing back and forth, and a soft toothbrush. That's going to be the key, the factor, is making sure you're not brushing too hard and that the toothbrush is soft. If you're using a medium or hard toothbrush, the bristles are too stiff and too firm to gently slide up underneath the gum line and be able to effectively clean up underneath the gum. And so that's why the soft bristles of the brush are what we recommend. Soft bristles slide gently up underneath the gum. They don't scratch up the gum, and they don't harm your teeth and your roots.
And what I learned from an earlier presentation that you gave is the angle that the toothbrush.
The angle, right.
Could you go over that?
Yes. So if you're putting the brush at an angle, say this is the brush. You want to have the brush at a 45-degree angle so that you're aiming the bristles up underneath the gum line at an angle, jiggling the bristles away, and then sweeping the brush in the opposite direction of the gum. And you're going to sweep down for the top, and then you're going to sweep up for the bottom. So that 45-degree angle is important to be able to effectively clean up underneath the gums.
I had just never heard that before, and I thought that was quite interesting. Okay, another question. Are triple bristle electric toothbrushes good to use?
Triple bristles with the 3 rows, that's probably what the person is talking about. And so with the triple bristle brush, I use a triple bristle brush handheld, and an electric toothbrush for my son. because I'm a caregiver from my son. For my son, he has special needs. And so when you're a caregiver or just for yourself personally, that triple bristle brush, can't say bristle, triple bristle brush is going to hit the insides, the inside of the teeth, the outside, as well as the chewing surface all at the same time. So those are a good option if that's what you want to use.
Okay. Well, those are our questions for tonight. And again, I am just so grateful that you took the time to share some things that maybe we used to know, or maybe we used to do, but these are wonderful refreshers. So thank you very much. And to everyone
for
at
having me.
AgingWell, thank you for being here. Thank you for being with us. And I want to date with you on May 14th. Please make a plan to join us. And until then, live well and let's age well together.
Thank you.